Welcome, everyone. My name is Valeria Matteo from Gemelli Hospital in Rome. Today, I'm joined by Dr. Steven Shamah, and we will discuss our article, Automatic Endoscopic Gastroplasty for the Treatment of Obesity, Results from a Prospective Multicenter Study.
My name is Steven Shamah. I'm an interventional endoscopist and chief of endobariatric endoscopy for the Khalid Health Service, currently working at Ha'emek Hospital in Afula, Israel. We look forward to explaining why we performed the pilot trial and its important contributions to the field of endobariatric endoscopy.
So, Steven, could you explain why we decided to perform this trial?
We wanted to perform the trial to assess the safety and efficacy of the automated suturing platform known as the EndoZip. There exists data with the use of a previous version of the device. However, the automated feature would allow for reproducible, durable results that would allow us to expand the procedure set for the treatment of obesity globally.
Thank you, Steven. And now, could you summarize the overall takeaway points from the study?
Thank you. The overall takeaway points can be presented in three general categories: efficacy, safety, and usability. In the efficacy, at the end of a 12-month follow-up period, there was about a 13 to 16% total body weight loss and about a 35 to 55% excess weight loss, which is similar to the results that we see on other similar endobariatric trials, and most recently the MERIT trial, a randomized controlled trial looking at endoscopic sleeve gastroplasty. On the safety results, we were able to see and demonstrate that it is a fairly safe procedure and device. There are only 2 adverse events across 45 patients. One, endoscopic bleeding or bleeding in the upper GI tract was managed endoscopically. And the second, a perforation, which was due to user error, was repaired surgically. Both patients were discharged from the hospital, and both reasons for the adverse events were addressed, and they did not recur later on in the trial. Both adverse events happened within the first couple of patients of the trial. In regards to usability, after 2 to 3 procedures with the device, all clinicians across 3 centers became independent users of the device without assistance. All suture patterns were identical across all 3 endoscopists and across all 3 centers.
Thank you. Now, could you explain how does this endobariatric device differ from the other devices available on the market today?
Thank you. The automatic suturing platform differs from the other manual devices in and of its own definition or description. The EndoZip procedure, or the EndoZip device, produces an identical 6-centimeter plicated, durable tunnel every time the button is pressed, no matter who the endoscopist or what center or what country it is performed in. Thereby, in comparison to our manual devices, almost every endoscopist performing an endoscopic gastric restrictive procedure, there is quite a lot of variability between devices, between procedures, between endoscopists, and between settings. Between the short learning curve and the reproducibility, we assess that this will enable gastroenterologists that don't have advanced training, that aren't interventional endoscopists, the ability to perform endobariatric procedures, increasing the amount of clinicians that can minimally invasively treat obesity in patients who do not want to undergo surgery.
Okay, thank you. And now moving on, what impact do you believe that this new device will have in the field of endobariatrics?
So I believe because the user learning curve is so short, I believe that this device will really expand the endobariatrics usability or endobariatrics field. We feel that endoscopists who don't have a year or 2 of advanced endoscopy procedure may not be doing very complex ESDs or EMRs or even endosuturing procedures if you can really pass an overtube, you can use the automatic suturing platform. You can position it in the gastric cavity, hit a button, and it's really self-explanatory. And after 2 to 3 procedures, you're able to do a full endobariatrics procedure. We know obesity or globesity epidemic is not going anywhere fast. It's expanding, and we need a bigger armamentarium and more physicians doing procedures to help our patients lose weight. So I believe this may be a paradigm shift, moving gastric restrictive procedures a little bit away from the advanced endoscopists. I believe there's not enough populations to share for all our patients, but I believe this will help globalize endobariatric procedures for gastroenterologists and advanced endoscopists alike.
Thank you, Stephen, for your thorough explanations. And now, what are the future perspectives with this device?
So the pilot trial was a pilot trial. We had, 45 patients with a BMI between 30 and 40 with comorbidities, but not all of them, not each patient had a comorbid conditions. Future directions are to look at the impact of not only weight loss, but obviously on the improvement of the metabolic syndrome, which we hope to see in a currently enrolling study. We also are looking the next couple of years to be a part of a larger pivotal trial, which will be multiple tertiary centers across the US, Europe, and Middle East Asia, to see a randomized controlled trial using our device against lifestyle management, similar to the MERIT trial, with a 1-year follow-up, so we can see and show that our suturing device truly has the results, the weight loss, and the safety for that will rival other procedures that we currently use today.
Thank you so much. Now, I want to conclude by saying thank you to everyone who contributed to the study. And I want to thank GIE for the opportunity to publish our findings and to further spread the word of this new device by conducting this interview. And now I wish you a nice reading.
Thank you very much.